Phillipa, it is always a pleasure listening to you. So I'm going to put you here, remove myself from stage, add you to the stage, and then everyone should be able to see and hear you. If there's any audio or visual issues, I ask anyone, a volunteer, to type something into the chat box, and then we'll work and try to fix it. Now on the screen, you should see Phillipa and the presentation.
Well, thank you so much for that kind introduction. And just to let you know, you've gone. There we go. Oh, no,
I'm here with you. I'm listening.
Oh, okay. Well, it's wonderful to be here. I'm so excited to share my pet project, which is Movement Made for Menopause. And, I have a personal interest in this because I am post-menopause myself. And so menopause fitter, stronger and healthier. That's what I'm hoping for more and more women around the globe. So I'm really looking forward to diving into this topic today.
And for a lot of men to kind of at least get some context around it, because even the men are all surrounded by women.
Yeah. Well, no, especially because what our audience are therapists. So regardless of whether they're men or women, they're working with women, they've got women in their lives. So spreading this message of movement made for menopause and, educating ourselves, our colleagues, our friends, our families about menopause and the effects on a woman's body. This is my mission, and this is something that you know about me.
Absolutely.
So without further ado, I think we should make a start. So thank you so much for that kind introduction. As Danny said,
and you might do a better job than me. That's why I'll allow you to express all the acronyms and experience, because it is vast.
Yeah, well, that's vast. It's because I'm old, Danny. That's why. Well, so hello, I'm Phillipa, and I'm a chartered physiotherapist. And my specialism throughout the whole of my career has been musculoskeletal therapy, and so this is something that I loved from the inception of my training as a physiotherapist. Coming from an athletic background, I gravitated towards musculoskeletal therapy. And so later on in my career, for about the last 18 years now, I've been a clinical Pilates teacher. More recently, I've added Hatha yoga to my repertoire. And so in only 4 years ago, I decided to become an entrepreneur in midlife and started my company, Precision Limited. And so I treat people in person. You can see the treatment couch at the back of me, and I work virtually online. And I really hope to reach people all over the world with my messages and my support and guidance. So we're talking today all about menopause and movement. What is menopause? The aims of our session, we're going to talk about what is menopause, the symptoms of menopause, and really the thing that I'm concerned to transmit to people is that there are long-term effects of menopause on a woman's body. I've had many a client and a friend who comes to me and mops the brow and said, "Ooh, menopause, I think I got away with it." Well, in all honesty, no woman is getting away with it. Admittedly, some women will suffer more than others, and I was one of those women. But the good news is that movement is great medicine. It's medicine that can help us to manage symptoms, certainly to improve our quality of life. And one of the things that we are increasingly coming to understand is that muscular strength is one of the most important variables that we could address as an aging population as a whole, but as women in particular. And so that's something that we'll be focusing on as we go through the presentation. I welcome your questions. Danny is going to throw any questions at me that are pertinent. And of course, there'll be time at the end for us to get to those questions. But what is menopause? Menopause marks the end of the reproductive years, and it's a natural part of aging. It usually occurs somewhere between 45 and 55 years of age. but actually it's creeping up on us before we begin to notice symptoms, most likely. And for some women, that can be as early as 35. So that we really need to be on the lookout for the kinds of things that we might be anticipating at that time of hormonal fluctuation. So the definition of menopause is that it's when a year passes without having had a menstrual period. And in the United Kingdom, the average age for a woman to reach menopause is 51. And I was smack bang on the dot with that one. So this was me. Well, it's not actually me, you can tell that, but this is really how I felt around that time of menopause. And so we're taught to believe menopause is a natural phenomenon. Well, it felt anything but natural is what I say to people. If being hit by a bus is considered natural, then maybe. So not everybody, however, experiences symptoms, severe symptoms, but most people, most women will experience some symptoms. The age of onset varies and the severity varies greatly from woman to woman. Symptoms can begin months or years even before the periods stop, as I alluded to earlier. And although physical symptoms can reduce after the onset of menopause, lasting on average around 4 years after your last period, some women will experience them for much longer. And I have had ladies in the 70s who complain still of hot flushes. And I think one thing that unites a lot of women is difficulty sleeping. I don't know about you, but that's something for me that started in my child rearing years, when you're on the lookout or listening for children, creeping about the house at night time. And somehow for lots of women, we just never get back into the habit of sleeping well. And, invariably that's going to have ramifications. But if sleeplessness is new to you, then it could be that is your body's way of just letting you know that things are changing, things are afoot. So, as I said earlier, I was one of the 25% of women to suffer severe symptoms in the perimenopausal period. And that began for me when I was around 45. Gradually, it came on, but I don't brag, but it was definitely the case that I had almost all of the symptoms that were possible to have. And this really severely impacted my quality of life, and kind of unexpectedly, because I was always a very healthy specimen. Well, I still am when I go to the doctor. Even if I'm feeling out of kilter, they can rarely find anything actually wrong with me. So I rarely was somebody to go to the doctors, but despite the fact that I was exhibiting the majority of the symptoms of the pending menopause, the healthcare system really just wasn't meeting my needs. And so this really kicked off my quest to learn as much as I possibly could to support my own shifting physiology. So what does this look like? And you can see here on this chart, I love this pictograph, the representation of us at our peak hormonal concentrations, if you like. And then later on, we can see the estrogen is in our boots, or the levels are in our boots. It's not just in our boots, obviously, but the levels are way, way down. And so, this is precipitated by this changing balance of the body's sex hormones that happens when ovaries stop producing as many or as much of the female hormones, and we no longer release an egg each month. So there's also this decrease in progesterone. Estrogen levels are taking a nosedive, progesterone levels similarly, but there can be a time where the progesterone might be dipping lower and we become estrogen dominant. So there's lots of subtleties really in interpreting these hormonal fluctuations, but but characteristically what we see on blood results is an increase in the follicle stimulating hormones, or the FSH, and the luteinizing hormone, LH. So that's characteristically what we would see if we were to test. But that time of perimenopause is not really a great time to be testing because there's lots of fluctuation happening. And so the acknowledged way to to diagnose perimenopause is really through symptoms alone. So there's different, depending on where you look, you'll find different numbers for those symptoms, but 34 is the number that I quote. I mean, I think that's quite enough, don't you? And predominantly the main symptoms that women experience are hot flushes, changes in the periods, and that could be an increase in the frequency and an increase in the heaviness of a period. So it's not always, you might just assume that it's about your periods getting less often and less voluminous, but actually that the opposite can be true, and that was the case for me. An irregular heartbeat and palpitations. This is another common symptom. Night sweats, sleeping difficulties. These are things that we might associate quite readily with menopause. But fatigue, mood swings, anxiety, just general irritability. You might have experienced as a woman PMT, or you might have been on the receiving end of it. And that irritability is around these fluctuating levels. And so I'm smiling because my poor husband had to tolerate me being irritable for about 3 weeks every month and just 1 week of feeling slightly normal. So, irritability, that can really be a problem for people. And depression, panic can be something that comes upon us at this time, never having had it before, wondering what the heck is going on. Digestive challenges, bloating, and weight gain is characteristic around this middle life, and particularly around the middle part of the body. It's our body's way of trying to protect the region that is secreting the hormones. And of course, body fat has a potential to synthesize and excrete female hormones. So it's another way of trying to redress the balance. But for us as therapists, muscle and joint pains can be something that people begin to suffer with. And so widespread generalized joint pains, rather than a specific problem associated with a specific incident. It's more hands and feet. The small joints of the hands and feet might begin to be problematic. And then nerves also can be misfiring with electric shocks, pins and needles. And certainly for me, carpal tunnel was just horrific. With the work that I do, having dead hands every night, keeping me awake, as well as everything else, was just not cricket. Dry, itchy skin, hair loss, brittle nails. Now, a lot of these symptoms could be associated with other things. For instance, the hypothyroidism. And so this is part of our hormonal picture. It's not just about the female hormones, but all of our hormones can be a bit out of kilter at this time of life. Memory lapses, poor concentration, headaches, dizziness, gum problems, and some people report increasing allergies. And then, of course, we've got the pelvic health considerations. Now, as a musculoskeletal therapist, this wasn't really in my wheelhouse, I have to say, but increasingly I'm taking an interest in this holistic approach to treating the women that I work with. And so it's important for us all to be cognizant of the fact that the decreasing estrogen levels can have an impact and a bearing on the pelvic organs. Vaginal dryness is something that many women find very debilitating. It can affect their ability to exercise and keep fit. And so this is something that we really must take an interest in. And so now you know everything. Well, maybe not everything. There are unique symptoms that will be unique to an individual, and so it's important not to dismiss strange or unusual symptoms if we're seeing this picture that we could maybe puzzle together of a whole plethora of symptoms that women that we take a history from may just be reporting to you as a therapist, to us as therapists for the first time. And so the other consideration, of course, is a premature menopause. And that's an early menopause, earlier than the age of between 45 and 55. Premature can happen spontaneously with no particular cause, but sometimes it's as a result of surgical intervention. Cancer treatments, for instance, can also, women are given tamoxifen and drug treatments to suppress estrogen. So these women are sometimes flung into the symptoms of menopause as well as everything else that they've got to contend with. And so the likelihood is that the symptoms will be more drastic and feel a lot more prohibiting life in terms of the quality of their lives. And so premature menopause at a much earlier age can result in an increased risk for some diseases due to the loss of this protective influence of estrogen. Estrogen has a protective effect on the bone. It has a protective effect on the brain, to mention just two. So it is important for us to be mindful of a woman's hormonal history and to just have this thought about where they are on that pathway and if indeed they've been thrust into a premature menopause. So the long-term effects of menopause, and this is really where I'm passionate to share the messages that you may have not have had symptoms, but that there's estrogen's protective qualities are being removed as we are losing these levels of estrogen in the blood. So the risk is increased for osteopenia and osteoporosis. And from that, we would follow potentially with fragility fractures. And we know the increased morbidity and mortality that follows a hip fracture, for instance. So, you know, these are things to be taken seriously. And sarcopenia, that loss of muscle mass, it can lead to functional decline, disability, and falls. And here we go now, falling over with our osteoporotic bones. And that really is just a recipe for disaster. Dementia, the protective qualities of estrogen help to protect against these brain infarcts. And so heart attack and stroke are also potentially increased post-menopause. And I've already touched on the pelvic floor dysfunction, and pelvic organ prolapse is another very debilitating thing that lots of women might be dealing with without disclosing this to you on the therapy couch. So what does it look like? The imagery around this is maybe not 100% accurate, but it's nice to be able to put that into perspective. The left side of your image is normal bone and the loss of bone, this progressive loss of bone with an osteoporotic vertebra on the far right of this image, where we're seeing vertebral collapse. And so this honeycomb matrix of the bone is being impacted as a consequence of an altered relationship between bone cell synthesis and bone cell resorption. So it's that relationship between the osteoblasts that are building bone and the osteoclasts that are responsible for clearing up the redundant bone in the cell. And so these this relationship between the building of the bone and the removal of the bone cells becomes disproportionate, and we've got less building going on and a bit more of the clearing out. So this occurs in two phases, really. And the first phase is predominantly in the trabecular bone. And this starts around the time of menopause, even slightly before, as we are losing those estrogen hormones in lower concentrations in the body. And so this phase is defined as menopause-related bone loss, and it lasts for around 4 to 8 years. The second phase is a persistent, slower loss of both trabecular and cortical bone. And this is really age-related bone loss. And it's the only phase that happens also to men. And so during the menopause transition, the average reduction in bone mass density is around 10%. And approximately half of women are losing bone even more rapidly, perhaps as much as 10 or 20% in those 5 to 7 years around the menopause. So around 25% of postmenopausal women could be classified as fast bone losers. And as of right now, we wouldn't necessarily know if that was us or the clients that we were dealing with. So the other thing that's markedly affected by this changing in estrogen, the changing levels of estrogen, is sarcopenia. And, you know, this really matters to me as a lifelong committed exerciser. You know, the idea that I'm working harder than ever to just stand still sometimes can feel just a little bit frustrating. However, you know, this is just the path that we tread as women. And so it involves a loss of mass and strength. So the other thing that happens is a fatty infiltration of fatty tissue replacing the muscle contractile tissue. And then finally, an altered ratio of the fibers, the type 1 and type 2 muscle fibers. So type 1, characteristically, we might be familiar of as our fast twitch fibers, and type 2, more the endurance fibers. And so what we are discovering is that through aging, but also through this the effect of losing estrogen, there's an altered ratio, and so we're losing more of the type 1 fibers, and so the composition of the muscle is changing, and that has ramifications. If you think about your ability to dodge a runaway dog, for instance, or run after a bus or a child. So our fast twitch fibers are potentially going into decline, and that's something that we need to address in our programs of rehabilitation and movement. So skeletal muscle mass accounts for somewhere in the region of 30 to 40% of total body weight. And it really correlates with our ability to function and our general health status. Skeletal muscle mass in women peaks around the 3rd decade, and it decreases gradually thereafter. But there's an accelerated decline after the 5th decade. And I'm pretty sure by now you don't need me to tell you that this has something to do with estrogen. And so women can experience around a 21% reduction of muscle strength between 25 and 55. And an annual decline in performance is around between 1 and 2% after the age of 50, and could be as much as 3% every year after the age of 60. So we really have this, it's important that we have this knowledge, this gradual and generalized deterioration of skeletal muscle is associated with increasing adverse health outcomes. And so it's important for us to consider this as we work with women, you know, whether that's why they came to us or not is really, you know, the mission that I'm on, for us to just have this in the back of our mind at all times. And so, oh, sorry, I'm going the wrong way, everybody. The other consideration for us as therapists is connective tissue. So the pathways in which estrogen interacts with tendon and ligament tissue are numerous. And there's several possible ways that estrogen could influence the stiffness, failure load, collagen content, and the fibroblast proliferation in tendons. Suffice it to say that collagen synthesis is altered, tendons are stiffer and more prone to injury. The other thing that's potentially influenced is cartilage degradation. And so they found that there are 2 estrogen receptors in chondrocytes, and that provides some evidence that cartilage is sensitive to estrogens, which could thus mean that declining estrogen levels are implicated in the pathogenesis of osteoarthritis. And it's certainly true that estrogen deprivation at the menopause seems to be associated with an increased frequency of knee, hip, and finger osteoarthritis, and in the severity of hip osteoarthritis. So, you know, we're starting to see that the effects of estrogen are wide-reaching in a woman's body. And so I mentioned earlier the propensity for estrogen to protect the brain. And so declining levels contribute to an increased risk of dementia for women, and that's particularly the Alzheimer's type. Female hormones have regulatory actions on non-reproductive regions of the brain also. And this includes the prefrontal cortex, the hippocampus, the thalamus, and the brainstem. And these are all areas responsible for emotions, behavior, and reasoning. And so, you know, it's hardly any wonder that we start to get a little bit irrational. I don't like to generalize. I'm speaking from my own experience of you know, riding this roller coaster of hormones. And so lower levels of estrogen and progesterone are associated with slower nerve conduction speeds as well. And so, and an increased risk of peripheral neuropathy. So, you know, these are all considerations for us as musculoskeletal therapists, as sports therapists, when we're dealing with people, just to be cognizant of this fact. And so the heart and the wrist and the cardiovascular system, the vascular system. Menopause compounds many traditional cardiovascular disease risk factors, including changes in body fat distribution, reduced capacity to tolerate glucose, abnormal plasma lipids, increased blood pressure. And so, you know, gender has a bearing when it comes to our consideration of cardiovascular incidents. And so although women have a lower risk of stroke during middle age, during the 10 years after menopause, the risk of stroke roughly doubles in women. And so you see in this picture, this emerging picture of the female hormones having a role to play. And I think, you know, why are we talking about it now all of a sudden? You know, and it's really about the aging population. It may have been that women were not living to experience this level of decline in generations gone by. But, you know, with the advances in modern medicine, then we are hopefully, the average age of a woman is not the average age. Our life expectancy could be as much around 83. Sorry, the average is around 83. So, you know, that's a heck of a long time to be living without those hormones, 30 plus years. And going the wrong way again, sorry. So coming to the urogenital system, like I say, not top of my list as a musculoskeletal therapist, but this is very common amongst women. and it has a significant impact on sexual functioning, emotional well-being, and activities of daily living. So somewhere in the region of 50% of women will suffer symptoms, but only around 25% seek help. And so urogenital atrophy is this loss of elasticity, if you like, in the tissues, and it's a major cause of discomfort and concern in women as it aids flexibility of the vagina. Estrogen also has a part to play in maintaining the pelvic floor muscle mass. We've already talked about skeletal muscles losing mass and strength, and the pelvic floor muscles are no different in that regard. And then, we've got the genitourinary syndrome of menopause. This is a relatively new term, sometimes shortened to GSM. And it's really just an umbrella term to incorporate all the different kinds of things that could go wrong, the effects of menopause on the genital area, the urological and sexual functioning that, as I said, affects somewhere in the region of 50% of post-menopausal women. And so what do we do with all of this information? I hear you ask. And the answer in my book is there's not one symptom of menopause that movement won't help. And that all those categories that we've talked about up until this point, I include in that umbrella. And so any opportunity we've got to share the power of movement with our therapeutic approaches to movement, to exercise, whether we're working with recreational movement, know that all of these symptoms can in some way be ameliorated by movement approaches. So that's really what prompted me to put together the course that Neil Asher kindly hosts for me on their platform, which is the Movement for Menopause. And so these different elements incorporated into movement to build muscle and bone, brain boosting exercises. Motor control is a consideration if we don't want to trip or fall, and not to neglect the pelvic floor as a piece of this puzzle. Movement is pro-circulatory, so helping with cardiovascular disease. And finally, it can actually help with thermoregulation. So women who are regular exercisers are much less likely to struggle with hot flushes. And so when it comes to movement for bone, what are we thinking about? We're thinking about axial loading. We're thinking about impact. We're thinking about resistance training. But something that I learned that was really quite interesting to me is that bones get bored. Who knew is what I say. Honestly, I had no idea. But, it kind of makes sense if you think about it. If we keep doing the same thing over and over again, our bodies will zone out, tune out. And so bones get bored somewhere in the region of 10 minutes after we start doing the movements that we're doing. So variety is something that I incorporate in all the movements the approaches that I teach with my clients. And really keep the body guessing is what I say. So when it comes to muscle, tendon, cartilage, and nerves, we want to put these muscles and all the different joint structures through their respective movement cycles every day and maintain strength and stability as much as possible to prevent aches and pains. And strength training promotes physical resilience. It increases our physical endurance, so it tackles the fatigue element, and it can decrease the risk of physical injury. So, I call it my Pilates insurance policy, or your body insurance policy. movements that we make every day are really helping to keep us supple, to keep us strong, and minimize this risk of injury. And so we can think of the brain like a muscle. It's got plasticity. Use it and it changes in response. Ignore it and it atrophies like any muscle. Only 10 minutes of light activity increases electrical activity in the hippocampus, that center for learning, memory, mood, and emotion. And actually, we can see increases in the volume of the hippocampus in response to activity. So 10 minutes seems to be quite a good number. The bones won't be getting bored and the brain will be getting the benefit. And even just walking 3 times a week for 20 minutes was shown to improve cognition and creativity. And so sedentary 20-year-olds will generate half as many ideas as active 70-year-olds. And I like the sound of that. That's what I've got on my agenda. And strength training in particular. This increases levels of the brain-derived neurotrophic factor, which is sometimes shortened to BDNF. And I heard that called fertilizer for the brain. And that really struck a chord with me. When we're doing our muscle strengthening exercises, we're really bathing the brain in these neurochemicals that are going to promote retention of the neurons. And of course, when we increase the heart rate, we increase the synthesis of our endogenous cannabinoids and endogenous opioids. So those feel-good chemicals, honestly, I say this to everybody, do it and it works. And do it and you will definitely feel better for doing it. Some motor control, I talked briefly about the idea that movement processing skills and the excitatory potential of nerves will be altered when we incorporate skill-based training into our programs. So that might be the ability to step. I have stepping strategies that I use with people, and kind of fast feet, and doing more than one thing at once as well, which a lot of older people can feel challenged by. And this is when they start to experience trips and falls, because they're carrying something and they're moving at the same time, and all of a sudden that's just too much for them. So to practice these skills and retain the capacity to perform at any age is really what I'm trying to sell to people. And we know health promotion is a hard sell. There's no doubt about it. But if we keep banging on about it, then my hope is that some of this will stick. And so, like I said before, the pelvic floor, the urogenital system, the ramifications of pelvic floor dysfunction cannot be underestimated. And so if it's not in your wheelhouse to be dealing with this, but you kind of get the feeling that your clients are crossing their legs when they're sneezing, they're avoiding the jumping jacks, whatever it is, then we could have that conversation and make sure that they can access specialist support to deal with those sorts of issues. As I said, the circulatory system, the well-documented effects of exercise on the cardiovascular system, and so I'm not going to harp on about that. But last of all, the thermoregulation, that's quite an interesting one for lots of people, because especially if you've ever had a hot flush, and I've had a few, but they were not as bad as so many women that I know. So of all the symptoms that I experienced when I was having my perimenopausal period, thermoregulation, the hot flushes, really was not so bad at all. And I certainly had them mainly at night, and hardly ever during the day. And so there is evidence that exercise training that improves cardiorespiratory fitness reduces hot flushes, and that improvements are likely mediated through greater thermoregulatory control in response to increases in core temperature. And so we know that if we expose our bodies to experiences and sensations, then they kind of learn to adjust over time. And that was certainly my experience. So last and definitely not least, overall health and well-being for the rest of your life. I mean, if you're not buying that, I don't know why, because movement really can help to maintain the body's homeostasis. It leads to better sleep, lower blood pressure, and an all-round better quality of life. So sign me up for that. So moving on to the Movement for Menopause course that I put together for Neil Asher, and that's hosted there on the platform. There's a whole load of references for all of this material in there. If you choose to interrogate that more deeply, then this is something that's incorporated in there, the screening. It's important for us to evaluate the starting point with our clients. You don't need me to tell you that, and to set a plan for the direction of travel, but to make that in the holistic and in the broadest sense, and also for that to be integral with their values and their own goals for themselves. This is something that we're increasingly becoming cognizant of. And so there are a whole host of screening tools that are available for subjective and objective evaluation of our starting point. And it really depends on the person in front of us, which tools we might choose to use with each individual. And so, posture is something that comes under a lot of criticism. Posture is not standing still. Posture is dynamic. Well, fair enough. But we do know that there are a couple of key influences for posture. And so if you're going about your life and you're not having any trouble at all, well, okay, maybe we're not that bothered. But if you come in to see a therapist and you've got hip pain, you've got neck and shoulder pain, then we really do need to consider the role or the part that posture might have to play in this. And then, from a holistic perspective, certainly a lot of women are quite opposed to the idea of ending up, kyphotic. It's not aesthetic. And certainly it's putting a lot of load on structures that would happily live without it. So it might be that you include a test, and the wall to occiput test is something that you could include in there. When it comes to movement tests, choose a functional screen. Spinal movements, you might look at back stepping lunges, forward stepping lunges, squats, spiral squats. And then, of course, all our special tests that we could perform depending on the person in front of us. The timed get up and go, single leg stance, the sitting rising test, and we're talking about getting up from the ground. This is, it's pick your clients carefully if you're going to use that, but to observe somebody's strategy as they are getting down and up and down off the ground, it can be quite illuminating sometimes. The hand grip strength, the Frax tool, and of course we've got scans that we could, if we're kind of worried about people, then the DEXA scan is the bone mass density scan. And then we've got a whole host of pelvic health specific tools. And the pelvic floor disability index is quite a good one, quite commonly used. So goal setting and action planning is really crucial for success and active participation in your programs. And as I said, these goals should align with your clients' values, strengths, passions, be realistic and be manageable, and break them down into steps that clients can track. And in turn, we can celebrate the success together. So I am passionate about Pilates. You may or may not know that about me. But the Pilates principles are something that I really value as part of my approach to tackling movement with people, and particularly tackling movements with people who might be unfamiliar. So say, for instance, you did sport, but it was way back in your college days. And so in middle life, you're hearing all about this thing that exercise is so jolly good for you. And you're thinking, well, do you know what? I'm going to hit the gym. I'm going to think of getting fitter and healthier. And what's the next thing that happens? They're on the treatment couch because, getting fit to get fit was something that they omitted to do. So I love the Pilates principles, breathing. Okay, it's automatic, but the ability to bring the breath under our control can be really useful when we are coordinating breath and movement. And so practicing that ability and incorporating it into the movements that we make. And in rehabilitation, that's not necessarily something that we might have thought of, but at its simplest level, exhale with effort. That's something that I would encourage people to do. Here am I yanking on a rubber band, and I would encourage people to exhale as they pull on the rubber band, exerting a force. And I'm increasingly reinforcing these beliefs that achieving neutral organization of the joints as we incorporate load is an important consideration. And then the ability for us to understand what it feels like when the muscles of the core are switching on and doing what they should do automatically, but sometimes that automatic mechanism is interrupted. And so sometimes we need to bring these, what should be automatic, under our conscious control. And that also applies to the setting of the central core. And the principles I love, the idea that we concentrate on the movements that we make and pay close attention to the specifics of each exercise, means that, research has shown if we think about bending the little finger, the muscles of the finger will get bigger and stronger just as a result of thinking about bending the finger. So the idea that we incorporate this focus on the movements that we make can only serve to enhance the effects on the body. And so learning to control the body with the mind is a valuable skill, particularly if we have these tendencies to be a little bit dyspraxic. And I've got two sons, and they're both at opposite ends of the spectrum when it comes to the inherent ability to control movement. One is a natural athlete, and the other really has had to really practice and work at developing that skill. But the good news is we can work and we can improve on those skills. And so incorporating the phenomenon of concentration, precision, the trajectory of the moving part, and we can think about this in terms of the amount of attention that an athlete pays to the reducibility of movements. So the more reproducible those movements are, the less likely we are to hurt ourselves, and the more successful and impactful those movements are going to be. So moving with fluidity, elegance, and grace is part of what flowing movements would look like, and it's something to aspire to for sure. I did not set out in my life as someone who was naturally elegant and graceful, but it is something that people now remark upon. As I teach my classes, they think it's something that's been there all along, but no, it's something that's come along with this dedication to practice. And so, of course, we must consider the exposure to load. As I said, people embarking on a journey of health and wellness can all too often come unstuck when they start to incorporate load. And, but with body weight and resistance bands, just my most favorite piece of equipment, the possibilities are endless if we just have a little bit of imagination. And so incorporating the principles into everyday life, sometimes we isolate the movements and we really just focus on moving one bit of us at once, and that has its place. But ultimately, we're hoping to integrate these principles into the movements that we make as we go about our daily lives. And as with all things, practice makes for improvement. So, getting stronger. We're getting to the crux of the matter now. Muscle is an organ. It's so important for women in particular to work against that propensity for sarcopenia and muscle loss as we age. And so the benefits of muscle building go far beyond addressing muscle mass and strength. They increase muscle, increases our metabolism, it improves our posture, reducing the proportion of body fat, lifts the mood, improves cognitive function, and as I said, strengthening exercises are neuroprotective. Glucose control. Muscle is a sugar sink, so having muscle really helps with that control of blood sugar levels. And it helps us to stay injury-free and enjoy our hobbies and interests and grandchildren, should they ever choose to present themselves. So the principles of training, well, strength training is a science. And so there are a whole load of metrics that we can manipulate in the programs that we teach. And that's going to be very individual to the clients that you are working with. But of course, the variables, we can manipulate the duration, the intensity, and the frequency. And all of that depends on the desired outcome. So we're looking to increase muscular endurance, strength, and power. And so we manipulate those variables of load and repetitions to achieve these goals. The areas to target will really be decided based on the findings of an assessment, but key areas to target when working with an older age group include the hip, the knee, and the ankle extensors. And so to challenge ourselves is important, because if you do what you always did, then I actually wrote here, you get what you always got. But actually, as we get older, we're getting less. So to do what we always did is not going to cut the mustard as we get older. And so we've got to build progression into our programs to overcome adaptation. And so that can be achieved by manipulating the training variables. All too often, clients leave rehabilitation, they go to see a therapist, and I know this has happened, for me, that they come, they get what they think is a program of exercises, and they go away and they do it. But that really only takes us so far, and progression is really important, particularly if we want to think about preventing reoccurrence. And so considering function, that's really individual specific, isn't it? The people that you've got in front of you, are they golfers? Are they horsewomen? Are they equestrian, I suppose I should say? Do they ride a motorcycle? What do they do for a job? And what do they want to be able to do moving on? That future that you picture for yourself, what does that look like? And so we can kind of tap into that with people to get the buy-in to cooperate with these programs that really can be life-changing, but only if you do it. And so, Pilates has given me a real appreciation of the importance of technique. And, this is something that I consider to be even more crucial when we start to add load. And I see people all the time at the gym, because I go every week, flinging weights about, kettlebells, you name it. And that's okay for fit, healthy people. I was listening to a podcast only the other day, high intensity interval training. Now that's the newest thing, isn't it? Let's see how short a time we can take to get fit. Well, on this podcast I was listening to, it was fascinating because there was a researcher, sports scientist, and he was saying, well, there's been so much research done on high intensity interval training that it skewed the whole view of what's happening in training. And the reason is that researchers like doing research that involves this, because it's brief, for one, and it's kind of fun. So knowing that it's kind of fun and it's brief, but predominantly it's done with athletes. So is this something that the average person on the street should be tackling? Well, if you ask me, certainly not as a starting point. So let's get fit to get fit. I think I said that earlier. And so the Pilates, oh, hang on, I'm going backwards. The principles of strength training, we can use tests to really evaluate our starting point. What is the starting point? And, you know, I said the strategies that people might use to get off the ground. I've got a client and we did the sit to stand. How many times can you sit from a chair and stand up in 30 seconds? And this client, in excess of 70 years of age, you know, he started off in the 25th percentile, and now he's actually exceeding, you know, the chart. He's off the chart, and that's because he's trained and we've practiced and he's worked at it. And I love that that's possible, because it absolutely is. Grip strength test. This is a really simple test. The hand dynamometer we can use as a predictor for muscle strength. It's been ratified as a predictor, strength and endurance. So just something simple that we could do in a clinic setting. We don't have to go with a whole load of weights and do the 1 rep max. Although if you are a sports trainer, then that's something that you might be thinking of doing. So we make our evaluations, and then we make our decisions about the treatment variables, the training plan, the plan for training. And of course, this all really truly depends on our goals. So, oh, hang on, did I go the wrong way? Oh no, here we are. So, you know, for me, focus on the major muscle groups, you know, the quick wins. We want to get some quick wins in there, and focus on anti-gravity muscles and the extensors, like I said earlier. Incorporate a mix of pure anatomical movements and PNF-inspired movements, and strengthen in all key positions. So whether you're standing in a split stance, high kneeling, half kneeling, supine, sidelining, you know, you go at it. And so for function, if you think about all the things we do in life, it's not linear, and we're in all sorts of positions as we go through our day. And finally, execution is everything. So engage the brain and get imaginative and really have fun with this stuff. And that's what I do every day. You can see I smile when I talk about this stuff because I love it. And I hope you do too. So exercise therapy is really a way of helping us to reduce pain for our clients. I think we empower people when we pass the control over to them. I'm all about hands-on. You can see that I've got the couch here in the background. When it's called for, then, you know, we dive on the couch and I get to work. But exercise therapy is a way of accessing analgesia for people and empowering them to feel like they have some control over their symptoms and the way in which they manage them. And so regular exercise can help to prevent chronic pain. Mastering a new skill is really empowering, and it increases our confidence. So there's never a time when this same client I was talking about, I introduced him to a barbell and some weights last week, and he was absolutely thrilled to be lifting weights. Having watched people over the years in the gym, never felt the confidence to embark on lifting a barbell. And here we are now, he's getting stuck in with the barbell, and we were all happy about that, he and I. So feeling confident, and this can really help to override fear and anxiety and increase our self-efficacy. Learning's great for the brain at any age and at every age. The benefits of physical activity are undisputed. It's really important that we make time for self-care, so that even us as therapists, sometimes we find that we're busy with our clients, and then we're busy with our families. And if we can make time for our own self-care, then this is something that we really must prioritize for our physical and our mental health. And so we get a whole new lease of life if we join a community of people who are working towards the same goals to feel fitter and stronger and healthier at any age. And so thank you so much for sitting through this webinar. I've been really indulging my passion, and I hope that you have enjoyed listening and got some questions for us to tackle in the questions. Thank you.
Phillipa, that was fantastic. So thank you very much. That was really great. And again, I personally always feel you're passionate. So I think it's something that's hard for you to even find to hide if you wanted to. I'll tackle you with the first question that came in last. Is just that we have Rosie here from Australia asking if you're familiar with the Lift More study that was done by Belinda Beck in Australia.
It is something that I've heard of. Yes,
okay. I think Rosie, if you wanted to, Rosie was only asking if you were familiar with this. So Rosie, if you do have a follow-up question or anything after that, please feel free to also enter it here as we discuss.
Yeah.
So as you were saying, Phillipa, sorry.
No. I mean, it is in my consumption of this material is vast, and so I hear things and I think to myself, oh, I must go and have a look at this, and then the next thing I know, I've moved on. But thank you for reminding me for that, because I shall definitely go and have another look at that.
Me as well, by the way, because I am unfamiliar with it. I wanted to ask you, if there's any hacks that I use hacks in quotes, if you use with women that maybe waited too late, or who maybe have just not too late but experienced like symptoms for many years before they even went to even investigate what they're going through. Because I don't remember the exact numbers, but you mentioned that a very small percentage of all the women that have symptoms actually seek help, seek advice, and take action. So what do you implement with someone that's maybe waited so long before even approaching someone like yourself?
Well, I think if you would take away the slides from the screen, then I can be a bit bigger in the window.
Apologies. You're absolutely right. We have a dog here with us. Thank you.
So
there we go.
Yeah, thanks. I think the thing that I really encourage people to appreciate is it's never too late, and I think the information is power, peace. So that people having an understanding around what's happening in the bodies and the kinds of things that they can do to help. And so are the quick, easy things that you can do, I suppose, for me.
Well, actually, I used the word hack, but I didn't mean in terms of quick and easy, but like maybe something to help hook someone, to show them that maybe it really is never too late.
Yeah. I mean, this is the challenge for lots of people doing this kind of preventative medicine sort of work. But I think it's speaking to people's speaking into people's goals. The idea that, what do you want your future to look like? And that, so many of the people that I work with look around their peers of the same age, and they're kind of all sort of peacock-like and proud of themselves because they make this comparison, and they are doing well in terms of posture. They're doing well in terms of their physical endurance and their ability to function at this higher level. So how do we encourage that engagement? I think we just have to keep banging on about it, first of all, and to make it appealing and accessible. So, I was with a potential client last week, and she said, "I hate the gym." I said, "What do you hate about the gym?" Everything was the answer to that. So, this person is not going to go to the gym. But the idea, and people don't like the idea of sweating sometimes. Getting out of breath can be something, because if you think about it, anxiety can sometimes get us into that over-breathing cycle. And that over-breathing that over-breathing that comes with exercise can sometimes trigger that feeling of panic, and that association with panic. And so for some people, just the idea of over-breathing is not on their radar. They're not wanting to go there. So if we can really dig into, people's preferences and lose our own preconceptions, because, we're all guilty of this. I've got the things that I love to do, and in the past, as a younger person, I might have been guilty of writing off certain activities as pointless because they weren't hard enough. Well, there's no such thing as pointless when it comes to movement. And so for us to kind of override any preconceptions we might have, I've been on a few courses lately where Pilates has been criticized. And I say a few, I was on one, but she gave clarity around specific exercises. So that was fine. I listened to a podcast the other day, and again, yoga came under criticism, but from people who don't do it. So why are we dismissing things that we don't understand? I don't dismiss anything. I've had the good fortune to try lots of different things, but I haven't done everything. You won't catch me skydiving, put it that way. So, just to be open to the idea that all movement is good, even if it's just walking outside for 20 minutes every day, getting some natural daylight, and then to build on that. So this idea that we start a habit. I was listening to material again only this week where there was this sports scientist researcher was saying that doing 6 weeks of constant state cycling, so it's not strength training. Partly your legs, but it's kind of this cardiovascular training, steady state cycling, zone 2 training. And then when these people went on to a strength training program compared with people who hadn't done this cycling, the gains were greater. So we start simple, and we tap into the hobbies and interests that people have. Gardening counts. A client said to me only today, I had this job to do. It involved lifting planks, moving them and putting them somewhere else. She said, I put the tracker on and I did 20 minutes of exercise, so let's put the preconceptions to the side. All movement is good. Some is going to appeal more to some people than others. And our job is really to tap into that.
And are there things like that you, along your journey, realize, oh no, I shouldn't be doing that? Because maybe people are doing all the hard, right things. They are moving every day. They're doing all these things, but they're not sleeping enough, or they're not drinking enough water, which are maybe obvious things that we all agree on that we need: water and sleep. But is there something out there that maybe is hurting, women at this age, maybe that is helping the acceleration of all these symptoms?
Oh, well, yeah. So modern life, unfortunately, we're just about allergic.
Everything that we do. Yeah.
Yeah. So the implications of stress on the system, and kind of being out of your body. So
Yeah.
out of touch. When you're out of touch with what things that you do and the influence that they have. And so being disconnected is the most problematic thing for people. Oh, I don't sleep well. I drink coffee at 4 o'clock in the afternoon, and not putting two and two together. And I think we're all guilty of this to a certain extent. But, to help people to piece the puzzle together and the light bulb moment. And, I've been talking about muscle hypertrophy with older clients, and the fact that we need the building blocks. So although I'm a movement is my mode of operandi, as I call it, we can't ignore nutrition, the building blocks for muscle, the building blocks for hormones. And so to encourage people to take this kind of overarching umbrella view of their lives, and maybe do a bit of a survey, if you like, a lifestyle survey, because sometimes it's only when you write it down on a piece of paper that you realize, and oftentimes we have the answers ourselves to these questions.
We justify, we get used to the habits, we justify the habits to ourselves first before we even justify it to anyone else.
Exactly.
So look, that's great. I hope this. I think very helpful for people that joined here, who I'm assuming are from different places in life. Some therapists, maybe some personal trainers, some physical therapists, physiotherapists in the UK, and as mentioned in the beginning, really global. So it is amazing to see. So wherever you are in the world, whatever time it is there, morning, night, early morning, afternoon, thank you very much for joining. Phillipa, you were amazing, as always. So thank you very much. We've had a few people write in the chat asking about the recording. So there's a webinar page, registration page on neilasher.com, our website, where you will see the recording of this this webinar and previous ones on that page. It'll take us 48, 36 hours to get this one uploaded there. So give us a couple days, but the previous ones will be there. In addition, don't forget to follow us on YouTube and our social media channels as well, because the webinar and clips of it will be posted there as well. As Phillipa mentioned, that we do have a course that we produced together that is listed on our website, a couple courses, one specific to movement and menopause, but a couple other courses as well. So please check out the course, check out Phillipa. You'll see some information about the course before you purchase it. Again, if there's any problem or you weren't happy with it, we can always communicate with us and reach out. Any questions you have, any help anyone needs, you can reach us at support@neilasher.com. And we will get back to you within 24 hours on weekdays. So anything you need, feel free to reach out. Phillipa, again, thank you very much. Any closing remarks from you?
No, thank you so much for giving me this opportunity to, reach more people with this message that movement is medicine for menopause.
Amen. And I am trying to be a subscriber of that, and also a promoter and influencer, because again, it only helped me. And I was absolutely addicted to the school of thought that hard was all that counts. But I see more benefits myself, and I feel better when I move more, but not as intensely, not as painfully. So thank you for also continuing your influence on me.
Oh, well, you're very welcome.
Have a great evening in Shire. And everyone out there, have a great rest of your day. Good night, good morning, wherever you are. Thank you very much, everyone. And until the next one next month.
Thank you.